So last week was a very busy week. I took on 2 brand new baby kittens, both from different litters, both with different problems. We had little Wonky, who has a very, very terrible limb problem on the back legs. And I picked up another little one who had problems with his front legs. Now, lots of people do ask, why does this happen? What is it? I've never seen it before. But there's different things to why this can happen. So you have a congenital limb deformity, which is defined as something that is present from birth, and it's a deformity that defines a state of being unusually formed or mishappen. A kitten that has bent limbs may unfortunately have congenital deformity. This may be due to the genetics of the kitten or some other factor. Now, we brought this little one home. He was covered in fleas, so I had to make sure that I got all them off, let him relax for a night, and then the next day I took him to the vets, and we was able to get some casts done with some aluminium plates in, which would help strengthen his legs as he grows. So he is very young, but he is already adapting to using his legs like this, and hopefully they will straighten out over time. They may not straighten completely, but it will be better than him walking on his limbs. Now, there is another factor, and it's genetic deformities. Genetics are passed on through the kitten's parents, and either of the cats may pass on a genetic trait that makes the developing kittens more prone to limb deformities. The deformity may affect one kitten or the entire litter. Any limb can be affected, although it seems to be common for the forelimbs to be most affected by the genetic deformity. That's the back legs. The forelimbs appear bent and angular and often pointing inwards towards the body, just like Wonky's legs. Now, the forelimbs appear bent, and sometimes they can be really hard to try to get them back into place. Sometimes the limbs are also splayed outwards. This is also a case where we call it swimmer's syndrome, away from the body. The condition is usually immediately noticeable from birth. However, it may sometimes be developmental, becoming more obvious around 6 to 8 months of age. Another key factor is when a kitten that presents itself with the poststernal limb deformity. It's often a result of overcrowded uterus or birthed from a petite female cat, normally a very young female kitten who has given birth. Now, these can range in any sizes from a singular kitten to over 12 kittens. That would be quite a squeeze in the cat's uterus. So I had a mother cat. She had 5 beautiful, healthy kittens, and I was very, very worried that we would face something like this, but thankfully we didn't. Now, there are many things you can do to help kittens who are like this. You have physiotherapy, splinting, surgical intervention, and a few other things you could do. But most commonly, splinting is the way to go. It's normally required if the veterinarian surgeon may splint the leg into a normal position. This involves using a rigid support to straighten the limb, just like we have on Milo's legs. In addition of padding it to help prevent sores, of course, the splint will keep the limb in a correct position, and then as the kitten develops, the limb may slowly return to a normal position. Don't forget to subscribe and press the bell button to see more wonderful videos of my kittens.